What diseases can be caused by lack of vitamin D? A lack of vitamin D, also known as vitamin D deficiency, can lead to various health problems, including the following diseases and conditions. 1. Rickets, in children. Rickets is a condition in children characterized by soft and weak bones, leading to skeletal deformities such as bowed legs or thickened wrists and ankles. This occurs because vitamin D is essential for calcium and phosphate absorption, which are necessary for healthy bone development. 2. Osteomalacia, in adults. Osteomalacia refers to the softening of bones in adults due to defective bone mineralization. It can cause bone pain, muscle weakness, and an increased risk of fractures. 3. Osteoporosis. Long-term vitamin D deficiency can contribute to osteoporosis, a condition where bones become brittle and fragile, increasing the risk of fractures, especially in older adults. 4. Muscle weakness and pain. Vitamin D plays a role in muscle function. Its deficiency can lead to muscle weakness, aches, and cramps, increasing the risk of falls and injuries, particularly in the elderly. 5. Immune system dysregulation. Vitamin D deficiency can weaken the immune system, making individuals more susceptible to infections, including respiratory infections like colds, influenza, and possibly COVID-19. 6. Autoimmune diseases. Insufficient vitamin D levels may be associated with an increased risk of autoimmune diseases, such as 1. Multiple sclerosis, MS. 2. Type 1 diabetes. 3. Rheumatoid arthritis. 4. Inflammatory bowel diseases. 7. Cardiovascular disease. Low vitamin D levels have been linked to an increased risk of hypertension, high blood pressure, heart disease, and other cardiovascular problems. 8. Diabetes and metabolic disorders. Vitamin D deficiency has been linked to insulin resistance, increased risk of type 2 diabetes, and metabolic syndrome. 9. Complications in pregnancy. Pregnant women with low vitamin D levels may have an increased risk of preeclampsia, gestational diabetes, and low birth weight babies. It may also impact the baby's bone health. 10. Depression and mood disorders. Vitamin D deficiency has been associated with depression, seasonal affective disorder, SAD, and other mood disorders. It may affect brain function and the regulation of serotonin. 11. Chronic pain. Some studies suggest a link between vitamin D deficiency and chronic pain syndromes, including fibromyalgia. 12. Increased risk of cancer. Deficiency may contribute to the development of certain cancers, including breast, colon, and prostate cancer, though more research is needed to establish a definitive connection. 13. Respiratory problems. Low vitamin D levels have been associated with asthma exacerbations and an increased risk of respiratory diseases, especially in children. Prevention and management. 1. Sources of vitamin D. Sunlight exposure, vitamin D-rich foods, e.g., fatty fish, fortified dairy products, egg yolks, and supplements if needed. 2. Testing and treatment. If you suspect a deficiency, consult a healthcare provider for a blood test and appropriate supplementation guidance. Maintaining adequate vitamin D levels is crucial for overall health and well-being.